Tunnel means you will be able to see only the straightforward things. Peripheral side, you will lose your vision on the peripheries. There will be a fundoscopy finding of flame-shaped hemorrhages. The retina will be red everywhere. Then you might need IV antibiotics. How do you know it is causing cellulitis? There will be redness, there will be swelling, there will be fever. Retinitis pigmentosa. What is this? This retinitis pigmentosa. So this is an genetic disorder. What happens in retinitis pigmentosa is that a person suffering from retinitis pigmentosa has some abnormalities in their gene. Due to these abnormalities, we know our retina has two types of photoreceptors, rod cells and cone cells. The rod cells are responsible for viewing in dim light or night vision. In retinitis pigmentosa, the person's rod cells gradually began to be destroyed due to abnormalities in the gene. That's why they suffer from night blindness. They are not able to see at night. Okay, so this is retinitis pigmentosa. It is a genetic disorder. For exam, what you need to remember is, how do you know this is retinitis pigmentosa? Night blindness and tunnel vision and inherited. That means a family history will be there. This is called retinitis pigmentosa. So how does this appear in the exam? You will be told that a person has been complaining of difficulty in seeing at night or difficulty in driving at night. He also gave history of the similar condition in his father or in his paternal uncle, like any kind of family history with night blindness. And the impairment of vision, usually tunnel. That means tunnel means you will be able to see only the straightforward things. Peripheral side, you will lose your vision on the peripheries. Peripheral retina will be destroyed. This is called tunnel vision. This is called retinitis pigmentosa. Important thing is, the treatment you need to refer routinely to ophthalmology. Routine referral. This is not urgent. This is called routine referral. And see, this is the picture of retinitis pigmentosa you see in a fundoscope. See these black colored shadows. These are pathognomic for what? Retinitis pigmentosa. These blackish things. These are retinitis pigmentosa. Whenever you see PLAB-1, in the PLAB-1 exam, this picture, these black colored shadows, this is retinitis pigmentosa, genetic disease. How do you treat that? Routine ophthalmology referral. In case of cataract, you might also be given this thing. Not night blindness. They will be told that the patient is finding difficulties in walking at night or driving at night. But how do you know this is retinitis pigmentosa, not cataract? Obviously, family history. Retinitis pigmentosa will have a strong family history, and the vision impairment will be tunnel vision. That means only the straight things he will be able to see, won't be able to see the peripheries. And fundoscopy picture might be given. If you'll find these black shadows in retinitis pigmentosa. Painless loss of vision. Painless loss of vision. We have already read about two things in painless loss of vision. One is central retinal artery occlusion, another one is central retinal vein occlusion. I hope you remember that. In retinal artery, the retina will be pale, and in case of retinal vein occlusion, there will be flame-shaped hemorrhages, reddish retina. Okay, now we are going to discuss about two other things of sudden painless loss of vision. Another one is retinal detachment, another one is amaurosis fugax. Okay, so let's see how do we differentiate in between them. In retinal detachment, there are 4 F's: floaters, flashes, visual field loss, and fall in visual acuity. 4F: floaters, flashes, visual field loss. fall in visual acuity. If you find this 4F, you will be sure that this is retinal detachment. Another clue, answer retinal detachment in PLAB-1 is a curtain falling down or a dark shadow over my vision. This is retinal detachment. And risk factor is myopia. What do you find in ophthalmoscope? Gray opaque retina. Gray and opaque retina in case of retinal detachment, and the treatment is scleral buckling. Just remember the word scleral buckling, nothing else. Okay, so in PLAB-1, you will, if you find sudden painless loss of vision plus patient complaining of floaters, flashes, there is decreased visual field is affected, visual acuity is falling down or visual acuity is low, this is called retinal detachment. Treatment, scleral buckling. Another thing of sudden painless loss of vision is amaurosis fugax. This one, amaurosis fugax. Painless loss of vision with a sensation that a black curtain has come down. So how do you know this is amaurosis fugax? Transient. It resolves in 5 to 30 minutes. It resolves in 5 to 30 minutes. This is amaurosis fugax. Okay, so let's see how to differentiate in between these four things. Remember, the sudden painless loss of vision, there are four causes mainly for sudden painless loss of vision. What are the sudden painless loss of vision? Sudden painless loss of vision. Four things, sudden painless loss of vision. First one, central retinal artery occlusion. I'm just going to give you some clinchers to differentiate in between them. Retina will be pale. In case of central retinal vein occlusion, flame-shaped hemorrhages in retina. In case of retinal detachment, (4F) flashes, floaters. To identify amaurosis fugax to differentiate amaurosis fugax from all other, the three causes of sudden painless loss of vision is the duration. The duration will be only 5 to 30 minutes. The duration will be only 5 to 30 minutes. This transient loss of vision. The patient will say that I was blind or I couldn't see anything for the last 10 minutes and it suddenly, again, I got my vision back. So, sudden painless loss of vision, there are four causes in PLAB-1. Central retinal artery occlusion. How do you know this is central retinal artery occlusion? You will be given a fundoscopy finding with pale retina, or you will be given a picture of the fundoscope with a pale retina. We have already seen the picture, I believe. And central retinal vein, how do you know? There will be a fundoscopy finding of flame-shaped hemorrhages. The retina will be red everywhere. And in case of retinal detachment, you will have 4F findings. Flashes, floaters, these exact words will be given in the stem. Field loss, you will be told that the visual field is lost, or fall in visual acuity, okay? And in amaurosis fugax, the loss of vision will be temporary, just for 5 to 30 minutes. This is called amaurosis fugax. Amaurosis fugax, this is a Latin word which means transient. Amaurosis means transient loss of vision for a very short period of time. So remember, sudden painless loss of vision, you will when you see the word sudden paleness, loss of vision, you will quickly remember these 4 causes. Now, from the stem, identify one of these clinchers and go for the answer.